professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello everyone, I'm Dr. Sri Banerjee, and in this video I'm going to be going over a little bit more about how to use PICO effectively in order to formulate questions, specifically as it pertains to diagnostic tests. Now, when we're thinking about PICO and thinking about topic selection, narrowing down the type of topic that you're trying to look at, this is a powerful tool to be using for such purposes. But another area that I think you should seriously be thinking about how to use PICO is really evidence-based medicine. And what I mean by that is when you're trying to do research in especially using evidence-based medicine, you want to have a really thorough understanding of what your population is, or the participants are, and what the intervention or exposure is, and outcome. So it's a useful tool to teach students how to formulate these questions about the effect of a treatment in a testable way. And PICO definitely fits the bill for this. And I've lectured on PICO in many ways, different places, but felt like it needed to be explained again. And Cochrane actually it recommends to describe the objective of the PICO intervention reviews as to determine the diagnostic accuracy of the index test for detecting target condition in participant description. So you can basically, what you can do is, if you want, then you can write the description of the review for any intervention by filling in some of these blanks and putting in whatever the index test is, whatever the participant description is, and whatnot. So, folks, this is the basic layers of research. This is how you conduct research. You use systems that you try to take and then create ways that you can use these innovative ideas and systematically ask questions. That is what research is all about. And over the years, I've had many students that have graduated by conducting original studies, and you can see these techniques work. P is the population of interest. I stands for positive index test result. C for negative index test result, because that's the comparator, and then O for the target disease. So you can see more in box 1. And what I like about box 1, and I want you to pay attention to, are these percentages and these specifically these equations. So A over A plus C means that the positive index test group and those that did have breast cancer, so when we agreed on that, then that made up the vast majority of all groups. Now, specificity is a different concept than that, and so is positive predictive value, negative predictive value, and diagnostic. So these are equations that you will be responsible to know, definitely by heart, and so you would definitely need to take a look at these equations. These will appear on the USMLE, the medical license exam, and so case scenarios and case studies do ask these questions very frequently. But these were always and have been always considered questions that are fairly simple to determine if you know this information. So So if you were to get a case study in a medical license exam question, then you could quickly take the acronym like population of interest, women aged 40 to 74, investigated test result, comparative test for group, and then outcome breast cancer, and then do this. So see how this works. See how this can align with some of your medical epidemiology work, and of course with public health, this is the whole population instead of maybe patient. So in medicine, this might be just one patient. In public health, it's the whole population. So final remarks, there's two. One is that, the clinical questions about a medical test, it's not enough just to ask if the test is accurate. Um, how does it affect patient health? We might have a very accurate test. Mammography may be a very accurate test, but is it affecting positively women's health? The second thing is PICO. How can we use PICO? Well, it seems like there's two common types. One that is, you have, some sort of patient health that you're trying to investigate and trying to improve. So this would be a case study that you would write. And I've written case studies too. Or the second type would be, in fact, a whole population. And so there's also some other points that the authors make about determining the type of question. A test accuracy study compares the presence of the target disease in patients with a positive versus negative result on the index test cross-sectionally. And then finally, the distinction between two diagnostic questions is important. So you want to make sure that you know what diagnostic tests are and what you're using. So I'm just going through this a little bit to make sure. Most diagnostic tests are designed to evaluate the test accuracy of a single test. This wasn't really heavy on the diagnostic test, but I think one other one other point that I would leave you with is that the equation for odds ratio is definitely one that is important to know, and relative risk ratio is another one that is very important to keep track of, an absolute risk difference. But definitely odds ratio and relative risk ratio are important and powerful measures of association as it pertains to epidemiology. So these are all the major points that are in here. We've gone over three broad areas. First of all, we've gone over a framework which you can use to translate vast amounts of information in order to ask actionable research questions. Number two, we have introduced you to some important types of diagnostic indicators. We've gone over sensitivity, specificity, some of the important equations that are behind this, and then finally bringing it all together, seeing when and where some of these things are appropriate to be able to effectively practice evidence-based medicine within the communities that you are in. Thank you for listening.